Before I talk about this disease, I would like to brief a little bit about the integumentary system. As we can see here, this is the human skin model. Human skin is the largest organ in this system. The human skin is made up of at least two major layers, which are the epidermis layer and the dermis layer. Epidermis is avascular, while the dermis is vascular. Raynaud'S phenomenon is a lifelong condition that causes decreased blood flow to the fingers. It also occurs to the ears, toes, nipples, knees, or nose. However, it is less common. This is caused by the blood vessel spasm in those areas. The spasms are triggered by cold, stress, or an emotional upset. When exposed to cold or during emotional distress, fingers turn pale or white, as in picture number 1, and then it will turn blue due to the lack of blood flow. After the hands are warm, it will turn red. In severe and rare cases, sores on the finger pads develop and fingers may need amputation if infections occurs. These are the common symptoms of Raynaud'S phenomenon. For the diagnosis process, usually medical officer will ask you about the medical history and will perform physical examination. Other than that, you may need to undergo a cold challenge test. The tiny blood vessels in fingernails may be observed with a microscope. Patients who develop this disease after the age of 35 may be tested for an underlying disease. This is because they are at a higher risk to develop the secondary form of Raynaud'S. The secondary form of Raynaud'S is more severe than the primary form of Raynaud'S. Now, I am presenting about the common one, which is the primary form of Raynaud'S. Secondary form of Raynaud'S is linked with autoimmune disease or disease related to connective tissue, so it is more severe. There is no cure for this disease, but it can be managed with proper treatment, such as avoiding exposure to cold. This can be done by wearing socks or gloves or scarf in cold settings. Other than that, someone with Raynaud'S must live a healthy lifestyle. They must exercise regularly and they must not smoke. Other than that, they also have to control their stress. You may be prescribed calcium channel blockers or vasodilators to widen blood vessels and increase blood flow. There is no way to prevent and to avoid Raynaud'S disease. However, if you have any risk factors for Raynaud'S, you may be able to get diagnosed early. Studies shown that 5% of the US population has this disease. Majority of them are women. That's all from me. Thank you.